What must you have to prove a medical malpractice case in the state of Utah? Well, a lot of medical malpractice is governed by statute and by common law, and these are the things you need. First of all, number one, you need a duty. Not a duty, but a duty. There must be someone or some entity that owes you a duty to perform correctly. Okay? So there has to be a relationship. Obviously, if you go to a doctor and he misdiagnoses you, there's a relationship. There's a patient-physician relationship. Okay? So that's the first thing you need, is a duty. The second thing you need is a breach of the standard of care. A breach can be proved one of two ways. The first way is that the doctor failed to do what he was supposed to do according to the standard. The second way is that he did something that he wasn't supposed to do. So the two ways to prove breach are failure to do something that he should have done, and then he did something that he should not have done, he or she, or the facility for that matter. The third thing you need, okay, so we've talked about the first two things, a duty and a breach. The third thing that you need is proximate cause or causation. That's what attorneys call it. In other words, whatever the doctor did or didn't do must directly cause the problem that you have. Okay? It isn't enough that it happened. Like, bad things happen all the time. But whatever the physician did or didn't do has to directly cause, that's what we call causation, the harm, okay, that the patient has. So we've talked about duty, we've talked about breach, we've talked about causation, okay? And the last thing you need, of course, is damages, what attorneys call damages, or harms, or losses, okay? So if a doctor fails to diagnose something and that prolongs or worsens the problem, or causes death or loss of limb, and it directly caused that, then you have a duty, a physician-patient relationship, a breach, failed to diagnose whatever it was, causation, the failure to diagnose caused the problem to become worse, and then lastly, damages, cost a life or cost a limb or serious prolonged interruption in your normal affairs, pain, suffering, loss of companionship when somebody dies, of course. Those are the four things you need. I'll talk about how you go about proving your case in some other video, but that's what you need to prove a medical malpractice case in the state of Utah. Of course, we're happy to answer your questions. You can call us, email us, text us, George Tate Law. Thanks for watching, and please be careful out there.